All right, Jimmy. So tell me about your shoulder in terms of what it was like before the surgery and what you're dealing with right now, or how is it doing right now?
Right now it's doing absolutely great. Before the surgery, I couldn't sleep at night. I would sleep on one side for a little bit till it started hurting. I would roll to the other side till it started hurting. And then finally, when I got in and did surgery, like a week or so after, my range of motion increased and I just continued to improve. And so now I can do things that I couldn't do 2 or 3 years before I had surgery.
Excellent. Show me how high you can lift your arms. Both arms up as high as you can go. Okay, excellent. And then behind the back, do you have any pain at all in your shoulder?
Absolutely none.
Okay, that's fantastic. And how was the recovery coming out of surgery?
Coming out of surgery was absolutely awesome. I was off of pain pills like within a week. And when I had home health coming in and doing rehab with me, the lady couldn't believe that I had range of motion as far as I did within the first couple of weeks. And then I did home health inpatient therapy there for like, I think 2 months, and then I did outpatient therapy for like 3 months to get strength back.
Mm-hmm.
And mainly it was lifting weights and working on machines and stuff. And so at the end of like 1 year, I was back to swimming like 2,000 meters.
That's fantastic. You're a superstar. So this is the x-ray. This is the stemless arthroplasty, minimal bone taken away, and you're 2 years out now and you're looking great, man. So
Feeling great, using a chainsaw, working around the ranch, doing awesome things.
awesome. That's good stuff. Thanks, Jimmy.